Hello to all of you. This is the third installment in our video series explaining the pathway to residency in the US. Now, in the last video, I covered what was USMLE in brief, what are the pros and cons of USMLE, what is the simplified pathway with the perfect timeline which you should adopt for landing a match in the US, and also we discussed about step 1. Now in this video I will explain to you about what is US clinical experience, how you should go about it, and also about step 2. Now I am Alhan Firoz, a medical student from Jawaharlal Nehru Medical College, Bhagalpur, Bihar, and in this video let's start. Now, talking about US clinical experience, so this is one of the most important aspect of your CV when it comes to land a match in the US. US clinical experience is you basically clinical rotations in US hospitals, like we do in our internship in India. Like we rotate in medicine, surgery, pedia, all the departments in hospital. Likewise, in US hospitals, they require you to rotate in their settings so that you should know how their healthcare system works. Now it's basically of three types. First is electives, second is observerships, and the third one is externships. Now I'll explain all the three of these. First, electives. Electives means hands-on experience, and the primary condition for you to get these types of rotations are that you should not have graduated. That means you can only get these electives before graduation. So for doing these, you have to postpone your internship in your home country for a few months, go to the US, and then do these electives, and then come back, complete your internship, and then get your degree. Now hands-on experience means you can touch the patient, and you can do all sorts of procedure on them. Now second type is observerships. Now in observerships, the major disadvantage is that you do not get hands-on experience, and you can do these after graduation. But if we talk realistically, then the weightage of electives, or the like electives will score more points on your CV as compared to the observerships, because you have done all the procedures on patients, so the program directors will give more importance to electives rather than observerships. But if you have graduated, then there is no harm in doing observerships. It's also like something is better than nothing, so by following that, observerships is a good option. Now third is externships. Externships are hands-on experience, and you can get these after graduation also, but the pitfall here is that these are like very less as compared to electives and observerships. To get an externship opportunity is a very rare chance, but yeah, if you try hard enough, then yeah, you might even land an externship opportunity. Now these rotations are necessary to know the US healthcare system, to build connections over there, and also to score LORs. When you go for these rotations, you will work under the consultants or doctors over there, and at the end of your rotation you have to ask to your consultant very politely that, sir, ma'am, please write a letter of recommendation telling about how I did in my rotation and everything. So now these LORs are a proof to the program directors that yes, you have done some you have got some experience in US, and how was you during that time. So now these LORs are very important, very essential for the application. Now 2 to 3 LORs are recommended for healthy chances of a match, and which usually like a one clinical rotation usually lasts for a 1 month. So if you want to get 2 to 3 LORs, then you should at least rotate in the US hospitals for about 2 months. Yes, and one more thing, that each specialty comes with its demands of LORs, like or clinical rotation or clinical experience. Like some high demand specialties will require more and more clinical experience as compared to the specialties like family medicine, and which are easy to get into. They do not require that much clinical experience, and if you have good scores, then yes, you can proceed with less LORs also. Now these rotations are usually paid. That means you have to pay for it. There is a fee for these rotations, and it's usually around from $500 to $5,000. Now there's one more catch in this, that you can there are some universities which will give you free accommodation and everything, and the tuition fee is also very less, like $500. But the primary thing is that everybody will apply to it, so they are quite competitive, and they usually require your step 1 score, so that if you want to apply to these rotations, you should have given your step 1, and you should have got your step 1, so that you can attach those scores in your application. Now, rotation should be done in the specialty in which you want to pursue residency in future. So yes, this is kind of like a hack that you should already keep in your mind that what rotation or what specialty you want to get into, and you should do at least one rotation out of all the ones you have done, at least one rotation in that desired specialty. Now, the requirements for application for clinical rotations. So, when you apply for a clinical rotation, it's same like you apply for a match. I mean, that means you have to attach a lot of documents, a lot of evidence for a clinical application, rotation application, which includes college transcript, your dean's LOR, the AAMC standardized immunization form, the application form, and the English proficiency test requirements like TOEFL, etc. So, when you are done with all these things, you can apply for the clinical rotation, and then after you are accepted, you can go to US and you can have this clinical experience. Now talking about step 2, so step 2 consists of two parts. One is step 2 CK and the other one was step 2 CS. Step 2 CK is MCQ based exam and the step 2 CS was OSCE based exam. Now why I'm saying was for step 2 CS, because step 2 CS has now been cancelled permanently and it is replaced by certain pathways. I means that means that for proving your proficiency in the clinical experience, you have to yeah, they have given other options in the meantime, which are known as pathways, by which you can prove your proficiency or your capability that yes, you have enough clinical experience to work in the US. But soon they are saying that they will come up with something new, and that will replace the step 2 CS exam. Now step 2 CK is a 9-hour long exam with 45 minutes break and 15 minutes introductory tutorial included. So it has got 8 60-hour blocks with around 318 items, which questions items we are referring because the questions can be of various types, multiple and picture based and problem solving and all sorts of stuff. So that's why we refer to as items. Now the syllabus of this step 2 is usually third year subjects, part 1 and part 2. That means third year, final year, and usually it tests the clinical aptitude or related to those clinical subjects. Now the most important thing in regard to this step 2 is that the score of the step 2 exam, the 3-digit score, will become of paramount importance after January 22, because the step 1 will become pass fail. So program directors will look on to your step 2 scores only to to measure your capability of working. So yes, step 2 score will become of a huge importance after January 2022. Now this exam should be taken after final year exams or during or after the internship, because it tests the subjects of third and fourth year. So that's why you should take it this time. And now how I should prepare for it. So the recommended preparation material is first aid for step 2 and also UWords. So again the thing is same like step 1, that you have to practice more and more questions. There are certain question papers and everything, NBMEs, all sorts of question sets, so you can practice them and gain more and more confidence in your step 2 question material. So yeah, this was the video about US clinical experience and step 2. So if you have any doubt or you want to know anything more about a specific portion of this video, just drop it down in the comment section below and we will make a video on it. And meantime, please like this video, subscribe our channel and share it. And yes, we will meet you very soon. Thank you.